Hi there, my name is Camille Huckabee, and this is my medical terminology video project. My first word is metastasize. Metastasize. 45-year-old female Jane Smith deeply regret her decision to defer her annual mammograms for the last 3 years when she found out her newly diagnosed breast cancer had already metastasized to her lymph nodes, liver, and lungs. Acromioclavicular. Acromioclavicular. Clay sustained a grade 2 acromioclavicular joint separation today after a painful fall while trying to attempt a backflip on skis. Cholecystectomy. Cholecystectomy. Acute cholecystitis isn't always an indication for cholecystectomy, especially when the risk for recurrence is low and symptoms are mild. Rhabdomyolysis. Rhabdomyolysis. After 3 days of running from the police and doing IV methamphetamine, it was no wonder he was later diagnosed with rhabdomyolysis and acute kidney injury. Myocardial infarction. Myocardial infarction. The patient in room 3 is a 54-year-old female with history of obesity, hypertension, and hyperlipidemia who was admitted yesterday for an anterior wall myocardial infarction requiring immediate left descending coronary artery stent placement. Hypertrophy. Hypertrophy. Left ventricular hypertrophy is a type of heart failure that can occur as a complication of severe hypertension and diffuse atherosclerotic disease. Pharyngeal. Pharyngeal. Without pharyngeal erythema, tonsillar exudates, lymphadenopathy, pain with swallowing, or fevers, I explained to the child's mother that strep throat was an unlikely diagnosis. Immunoglobulin. Immunoglobulin. Testing positive for herpes simplex virus type 1 specific immunoglobulin G, but negative for herpes simplex virus type 2 immunoglobulin G, indicates a prior exposure to cold sores rather than genital herpes. Arrhythmia. Arrhythmia. Atrial fibrillation is a type of cardiac arrhythmia where there is an electrical impulse dysfunction causing the atria to beat out of sync or fibrillate. Dysphagia. Dysphagia. Treatment of neurogenic dysphagia is only possible if the underlying neurologic disorder can be treated, which in most cases unfortunately isn't possible. And that's it. Thank you.